Physicist Stephen Hawking once said, "Work gives you meaning and purpose, and life is empty without it." Based on that observation, the lives of each member of the Blessing Health System team overflow with meaning and purpose. During 2020, this team responded to a demand for care rivaling that of any period in Blessing's remarkable 145-year history. Hello, I am Maureen Kahn, President and Chief Executive Officer of the Blessing Health System and Blessing Hospital. And this is a brief look at fiscal year 2020 across the health system. COVID-19 served as the catalyst of the extraordinary demand for care. Between late March and September 30th, 2020, members of the health system cared for thousands and thousands of people, screening and treating at our flu-like illness screening centers, giving COVID-19 tests, answering COVID hotline calls, and conducting virtual office visits. Then there were inpatients. 192 people were hospitalized with the virus, requiring nearly 1,170 total days of care. And when demand exceeded the supply of negative pressure rooms for these patients, our facilities team quickly and expertly created more. In the meantime, we delivered babies, performed life-saving surgeries, and provided other non-COVID related clinical and support services required to improve the health of our communities. What the Blessing Health System team did and continues to do is nothing short of amazing. But it was not easy. Demand for care occasionally stretched hospital resources. More often, though, the pandemic drained caregivers physically, mentally, and emotionally. Fueled by their commitment to improve the health of our communities, the Blessing team never gave up and never gave in. And people noticed. People like Belinda Otten, the wife of a COVID patient who was hospitalized for 33 days.
We put our faith in God and our trust in Blessing, and he came home. In the worst situation, Bob received the best care.
And people like Amanda Smith, one of nearly 500 employees who, when the pandemic affected their job duties, volunteered to cross-train and become part of the pandemic response.
It was an enlightening experience to be able to see how we can all come together and get out of our comfort zones to bring comfort to our patients during a time of need. I was grateful to be a part of it.
The Blessing Corporate Services Board of Trustees created the opportunity for people like Amanda and set the stage for our pandemic response. While providers across the country and throughout the region laid off staff due to business disruptions, every Blessing employee who wanted to work had a job. Thanks to the commitment of board members to staff, their families, and the needs of the communities we serve. Now let's take a quick look at other key accomplishments around the health system. Blessing Corporate Services secured a state certificate of need to relocate the outpatient surgery center to the 11th Street campus. The center is on track to see its first patients in late spring or early summer of 2021. More than 50 new providers were recruited to the health system. 41 of them began their practices during the year. Blessing Hospital received a grade of A for patient safety from the National Leapfrog Group and earned high-performing hospital honors in several areas from U.S. News and World Report. Illini Community Hospital delivered patient engagement scores, putting it in the top 10% of similar hospitals in 7 of 8 domains of care. Blessing Physician Services opened the Blessing Health Center at 4800 Main, home to a number of specialties. 4800 Main also houses BPS's neuromusculoskeletal services and cutting-edge imaging capabilities offered to the region at new, lower outpatient pricing. Hannibal Clinic saw its employee engagement grow. The percentage of staff who would recommend Hannibal Clinic as a place to work soared by 23 points. Blessing Riemann College of Nursing and Health Sciences transitioned to a virtual online experience in response to the pandemic and held May graduation on time. Then, nursing graduates exceeded the national licensing examination first-time pass rate by nearly 9%. While toilet paper and disinfecting wipes may have been in short supply due to the pandemic, generosity was not. The Blessing Foundation received over 22,000 gifts, totaling more than $1.3 million to support the work of the health system. And Denman Services opened a store offering customers a new pricing structure. Denman Direct in the Blessing Health Center at 4800 Main sells its product as direct purchases. With no insurance accepted, customers enjoy lower prices. Fiscal year 2021 looks to be productive too. First and foremost, we hope the virus will be under control. We also plan to open the relocated outpatient surgery center, make a decision on the Keokuk Hospital joining the health system, and submit the final Magnet Nursing Excellence application for Blessing Hospital. In addition, new challenges await us in the marketplace. We have the energy for work ahead. It grows from the goodwill the Blessing Health System team built among the communities we serve through the pandemic response. This positivity will propel us forward. I believe in the mission of the Blessing Health System, in the people of the Blessing Health System, and in the future of the Blessing Health System. Thank you.